First thou shalt take out the holy pin, then thou shalt count to 3, no more, no less. 4 thou shalt not count, then count thou 2, expecting thou then proceed to 3. 5 is right out. Once the number 3, being the third number, be reached, then lobbest thou thy holy hand grenade of Antioch towards Thrive Loud with Lou Diamond.
Want to learn from those that are taking their lives, their businesses, and their passions to the next level? Best-selling author of Master the Art of Connecting and professional speaker Lou Diamond is here to connect you to some of the most inspiring and amazing people on the planet. Get ready to thrive loud with Lou Diamond.
Welcome, everyone, to another spectacular episode of Thrive Loud with Lou Diamond, connecting you to the most inspiring and amazing people that are thriving each and every day. I'm your host, Lou Diamond. Today on Thrive Loud, we have an individual who has always had a passion for pursuing knowledge. His passions led him from engineering to the intersection of healthcare and technology into a company called Span, a company that analyzes data from wearables to help people maximize their health potential. His goal isn't just to help people improve their health metrics. He wants to help them and their lives. He wants to help them live their best lives for as long as possible. The wonders of editing, I'll adjust that. Thrive Loud listeners, Patrick Samy. Patrick, how are you today?
Really good. Thanks for having me.
Okay, so really cool stuff. First of all, as we're on video, but our listeners can't see it, I'm a big fan of Wearable. I was just charging one of them.
Okay.
And I see you've got one on. You probably have more than another.
Another one here and another one here.
He's pointing to rings and what looks like something on the back of his tricep, and obviously a watch as well. So let's just go back before all the tech gear stuff. I actually want to. I understand your technology background that you've had, and you love to be inquisitive and learn certain things. But has health and wellness and being always been something that you've been? It has been important to you?
Yes and no. I think I've always been very curious. And when I was growing up, I was really into tech because my dad was into tech. So I had all these things around me that I was playing with. But when I was in high school, I studied biology. I took advanced biology and I was really into it, especially very specific topics of how the human body works. And again, there's this curiosity. We're all born with a body and we have no idea how it works, and we're figuring it out, basically building the manual as we're growing up. And I was just fascinated by how some of these things work and how some of these things can be different also across humans. But then the interest specifically in taking care of health and healthcare came from seeing a lot of chronic conditions in my family, seeing a lot of conditions like cancer that people were able to treat, but still that the type that have a very strong link with genetics, but also genetics doesn't mean that you're getting the disease, just means that there's some risk that goes up. And this risk is also associated with lifestyle and environment. Not that you can control everything, but actually for those specific types and for others, there's a lot of things you can do to reduce risk. Doesn't mean it's not going to happen, but my philosophy is if you can reduce the risk, you should do it, and we should all do it. The
advancement of wearable technologies is, talk about a hockey stick growth and also hockey stick acceptance. I do remember the first time I'd seen even a Fitbit come out. I was like, all right, great. This thing can count your steps, or it can, provide certain data. The explosion of understanding how much information you have and then being able to put it to good use. That's actually part of the challenge that's out there, right? We're finding all these devices that we have or wear that can track certain things, but assessing how to take that information and then figure out what works best. Tell me a little bit about your connective tissue here, literally, of engineering and healthcare and pulling this together into technology to probably ask the question, how can we really process this information better? Because I have a feeling that's what's behind what Span is about.
Yeah, 100%. I think if you think even 20 years ago, definitely 50 years ago, we were measuring heart rate for most people, even just to prevent your risk of stroke or heart attack or things like that. And 20 years ago, maybe we were doing that a bit more if you went to your hospital, in your GP practice, but we weren't measuring it continuously because those were medical grade devices that are clunky and not easy to use. And now I have this ring on my finger. That's the only thing I can wear. It measures my heart rate continuously. And when I'm sleeping, it measures my respiratory rate, my body temperature, and all these things. So this passive data collection on our health is a huge opportunity. But I was about 3 years ago in a situation where I had all these things and I was waking up and checking my sleep data, for example. And I was noticing red numbers, my deep sleep is low. What does that mean? What do I do to improve it? And I had friends who were trying things and had the same device, and it would work really well for them. And they'll get like a 15% increase on their deep sleep. I would try exactly the same thing in making the parameters as close as possible, and I wouldn't get to the same result. And I started reading into in the scientific literature about all the different biomarkers we have and how a healthy range doesn't really exist for a lot of these. Because first, we don't necessarily measure a healthy range as it's in an absolute way healthy. It's just the average range for the population. But if the population isn't healthy, then we just have the wrong range. And the second aspect is there's a lot of variability for specific markers. So the one I'm wearing here on my arm is a glucose monitor. So I can scan it with my phone. It tells me what's my blood sugar right now. And I have the full curve. So if I'm eating something, I see how much it goes up and down. There's probably 5 very robust studies to date that show that if you eat something and you have the next person on the street, I stick one of these on them and they eat the same thing, we won't have the same response. And we could have opposite responses, or like he could have a neutral thing when he eats a banana and it could spike like never before, like nothing else. And so what does that say about nutrition? That basically there's no way to come up with a diet plan that doesn't take into account context, what's the state of my health, but also other aspects like genetics and how my body is gonna respond. And so context can change a little bit. So if you're sometimes, if you become healthier, you could tolerate some things that the person could tolerate and you couldn't, but also sometimes it's just different. Some people can tolerate ice cream and some people can't. And so that means we have to personalize. And that's where I was in a situation where I was going online for a lot of advice, and the advice we have today on Google is just not personalized. And that became my mission, my obsession about, how do you close the loop? How do you find personalized interventions, changes, happy experiments that people can try? And how do you help them validate that without spending hours looking at the data and making complex calculations to understand that? There's a lot of statistics science already on this. And it was just about how do you apply that to that data? And then bringing my co-founder's knowledge in longevity, he's a medical doctor in longevity, and how do we marry the two parts of the science and the technology to build something that allows everyone to understand this data without making any efforts.
I actually like this because you're connecting, I love, as the description says on SPAN's website, data-driven health coaching. You're creating how that information personalizes what you need and what works best for you. I want to understand something that's obviously the biggest challenge is that the biometric data or tools that we have right now are varied. And maybe we would also argue probably inconsistent, or the way they're measuring certain things. I know this, that even my heart rate has been different on one device, that it's on my wrist and maybe something else. So obviously, look, that's going to always seem to get better. But bringing all this stuff together, because each business and each company that's producing these products is obviously trying to push their own platform and their own technologies and everything. How are you at SPAN pulling this all together so that it can be the best solution for anybody?
Yeah, I think you're completely right. First, all of these companies are building great devices, but even when they're doing a good job with the software, they always focus on their one vertical. And so the Ring, for example, is focused very much on sleep. They'll give you all the data from the lens of Are you sleeping well? What could you do to improve your sleep? Even the recommendations. The Apple Watch is sort of mostly for people who work out and do various different types of workouts, and they want to track all of these things. When you're wearing it on a daily basis, even if you try to wear it to sleep, it's not a great device. It's not comfortable. It's not accurate unless you put it on a very tight setting. It's just not a great experience. And so all these devices are very focused on these specific verticals, and the best way to really take into account sleep, nutrition, exercise is just bring it together, and then to show how these changes are happening in correlation with other markers, how your heart rate is changing and how your glucose levels, your blood sugar is changing at the same time. Is there any relationship here? Can we take into account how I slept the last night and what was the pattern in my blood sugar levels? And that's allowing me to figure out my blood sugar levels are impacted by what I eat. And if I see the relationship with the blood sugar levels and sleep, I can say that what I eat impacts my sleep in a specific way.
Right. Level setting. This is something I'm actually really interested in, whether it's for concussions or heart rates or diets or figuring that stuff out. I think it probably requires a little bit of data initially to kind of understand the human being, the individual, to take that information. How much does it take in the beginning to get it all pulled together, to get it on the flow so that you can now figure out what the right eating, what the right health activities are? Because it's the starting point that's always difficult. To your point, one person eats a banana, it might spike, and the other person, it might be a neutral advice. That's just at one moment in time. But when you begin to start tracking this, how is SPAN level setting everybody and all their devices?
So we're really measuring people and tracking their progress against themselves. And the way we do this is, I think that the first part is really trying to focus on the long-term effects. And so the way we see health and longevity is really sustained health output that's optimal or maximal for the longest period of time. And from that lens, I guess the goal with these wearables and the data is to just see how people are doing when they join. Often they have those devices before they join SPAN, so we see literally a year of data before that, and we can use that as a baseline. But also taking the concept of small habits, atomic habits or tiny habits, and making sure that we are trying small things that are constrained enough, but have enough impact so that you can measure something. So, for example, I'm going to try now every morning to wake up, go outside and look at natural light from the sky for 3 minutes. And I'm going to measure for the next 2 weeks how my my sleep interruptions are impacted, how my deep sleep is impacted. And this is one of the experiments we have on the app where we see the most impactful results on deep sleep and sleep interruptions. So if you come in and we see that that's something we can improve, some people will join and that part of their sleep is perfect. We work on something else. From some people, they come and we think the average is, think about it, when you fall asleep, you should probably not wake up, and the total sum of these interruptions shouldn't be more than 20 minutes, 25 minutes. Otherwise, it means you're waking up and staying awake in the middle of the night. And we've seen people join and have like an hour and a half of sleep interruptions. And in less than 2 months, reduce that by 3 and get to about 20, 30 minutes. And I think this only works because you're experimenting with those things. We have a database of scientific papers, which is the other thing you can find on Google, but that most people can't understand. They're running interventions and they're testing different groups of people based on their demographics and the data they have and so on. And they say this group is more successful when they do this. And we use that as a heuristic to say, we recommend that you should be trying this first. And so that first part is personalized. And then we look at your data to see how you're performing during that experiment. And so you're always compared to your own baseline for the 2 weeks before the experiment. And during the experiment, we can see how the data changes. We try and compute different scores that tell us whether that experiment is actually working and how confident we are that the change we're seeing is actually a solid change that you can be reliant on. You can say, okay, I'm going to implement this habit, and actually I'm going to do it now every day as part of my routine because it's something that truly has an impact. And then after 2 or 3 weeks, you're satisfied and you say, I'm going to keep doing this, and you move on to the next one. We look at the next area of improvement. Maybe it's the same metric, the sleep interruptions. We can still improve that. and we'll move on to the other recommendation and do that for another 2 or 3 weeks until we see whether it works or not. And so the coaching element here is really important, because when I'm saying this, you're probably thinking, whoa, there's a lot of qualitative information here that no wearable or no app is going to be able to collect. And so that's what happens with the accountability and the ability of the coach to take in that qualitative information and to adjust the process of testing those experiments. So the coach is available all the time on the app, and you can chat with them, and they'll check in every week with those results and help you navigate that process of deciding what to do and how to interpret the results.
I've got a bunch of areas I want to go in this. I'm going to try and figure out which fork in the road I'm going to go down. I'll keep on the one that you're on. And that is in the types of reporting that you're going to provide to people. Is this daily updates, monthly reports? Explain the communication and assessing people's health coaching, what the frequency is that they can learn about exactly what they're dealing with.
Yeah. On a daily basis, we're tracking adherence to that new habit we're trying to implement, and we're testing. The goal is to see how the adherence is. So when you're doing that experiment, how that's affecting the results. Are we seeing a meaningful impact because you did it today? And so we track that over time, and that allows us to see a score. And that means that on a daily basis, you can also see that score change. It's very simple, from 0 to 100. And it's in an absolute way, it's interesting because it's moving every day, but also after some time, you can see that it will stabilize around a number. And that number you can compare to every other habit that you've been experimenting with. And so you can see waking up an hour earlier compared to eating dinner 3 hours away from going to bed, compared to morning light exposure, compared to taking magnesium before bed. And you can see the impact of all of these habits on the same metric, sleep interruptions, for example. No. And so that score really allows you to very quickly, every week at this point, compare how you're doing. And then every month we kind of reassess, and we say, okay, we've been running this, we've reset, and we're kind of measuring the new baseline now for a week, and we decide what to do next. And that's a conversation that happens with the coach in a Zoom call or normal call.
In the spirit of, because SPAN is focused on coaching, which is always like taking you from par to greatness. Obviously, there's incredible focus on what we'll just call rehabilitation or maintenance. Think of people who are diabetic, who have heart conditions, that type of information. And as it relates to the way that you track what you do, because obviously there are people measuring glucose levels who are diabetic and are also trying to maintain their healthiness. How is spanning the range of that bit from health coaching, taking in your grade, but also dealing with people who have underlying conditions that need to be monitored as well?
Yeah, so today we're very much focused on people who don't necessarily have a chronic condition, or maybe they have something like sometimes someone joins and they're pre-diabetic, but they're pretty far on their journey and they've almost reversed it because it's been dealt with early on, and they had borderline blood sugar levels, and they were able to get it down to normal range. So we often see that people have already started on their journey, and they're like, okay, I need the accountability. I know that a coach is useful for me, but I also want someone who is helping look at this data, because a normal personal trainer or nutritionist doesn't care or doesn't have the time, and the model doesn't work because they don't also have the technology to do this. And so this is really where the experience is slightly different. There's someone who said that they were using one of these tonal machines to train that measures a lot of data. And before, they used to train in the gym with a personal trainer. And now they train on this machine, and they only hire the personal trainer to not actually tell them what to do, to just look at the data and tell them, what do you think? What should I be changing? Should I be doing that many reps of this and then change to this? And so it's a completely different mode of coaching, where you're asking someone to assess and review your progress based on the data rather than tell you what to do on the spot.
Right.
And you're much more in the driving seat. And I think that requires a very specific type of mindset. So we're taking into account all the things we're learning on the behavior change with these individuals who are a little bit more motivated today to craft something in software that allows us to build better behaviors, and behaviors that are lasting longer without necessarily putting more effort. And as we're learning this with this population, we're planning to expand to a population that's maybe a little bit less like that, or maybe they just bought one of these Apple Watches or Oura Rings and they want to start with this, but they don't necessarily have the initial level of motivation and need help to build that.
So let's talk about you a little bit. I want to shift this because you're leading a company that does this. We'll focus on the business model of Span when we get to the plug section here. But as you went on this journey and helping to put this service and product together, this very cool data-driven health coaching service, did you become more conscious and more health focused along the journey? Like, I should be working out more. I should be eating more right. Talk about your personal transition and understanding of your own numbers and data as you were going through this.
100%. I wasn't planning on starting a business really. I was working as an engineer, sitting at the desk for most of the day. I did that for 3 years. And before that, I was still in university. So I had played tennis my whole life and I've been competing my whole life almost. When I started working full time, I stopped training as much. I was playing maybe once on the evenings during the week because you're working. So, and then maybe a couple of times on weekends. So maybe 3 times a week. That ratio and the intensity of that training completely changed. And I realized that I wasn't 25 anymore and I couldn't get away with a lot of things I could get away with when I was younger. And so after these 3 years, I was 28, 29, and I realized that things weren't going in the right direction. Did a blood test, got these wearables. Nothing was really optimal. Nothing was out of range either, but everything was kind of borderline or trending in the wrong direction. And I spoke with one of my friends, Adam, who's an MD, but really the kind of MD who wished there was a longevity or preventative specialization after medical school. And so he was basically a longevity nerd from that perspective. And he kept checking in with me every week for 6 months and saying, okay, this is what your heart rate changing when you're doing that type of exercise means. You want to hit that zone and you want to do that consistently for a month. And then we'll see your resting heart rate change. And so we basically ran that experiment concept without really verbalizing that for 6 months. And we've improved my mental clarity, my energy levels, and all these things. That was the kickoff really for me. And so I spoke with Adam and I said, the last time I went to a sports medicine clinic or like one of these longevity practices, they wanted to charge me about $5,000 to $15,000 a month to do that very intense program for 6 months. And we've done this, and you took probably 30 minutes of your time every week. So there's something to do here. The technology that we were using, even though we had a spreadsheet at the time, literally, can be built into something that's much more scalable and useful for people at a larger scale and a lot more accessible than these services. We're probably going to do 80% of what they do with that specific focus we have. We won't be able to diagnose conditions and like help you do specific things you need to do with a professional on the spot. But a lot of these lifestyle things, you don't really need that sort of interaction to know what you do and to then change it. So we started the business based on that initial insight. And for the last 2 years and a half now, I've been discovering so many things from the team. We have amazing coaches who are extremely knowledgeable. They share stuff with us every day. And we're like, whoa, I had no idea I should be doing this or even trying it. And then we're also learning from our members because we're now we have more than 100 members on the program. We see a data set and we see people doing things that a lot of people talk about, but we've never really measured this at the scale that we're measuring it now. And we're seeing some really incredible results. So that's everyone in the team is really passionate about trying these things. We're all living by this book, and we are all trying these things. And my focus is really, at least right now, on sleep and trying to find a very consistent pattern of getting specific types of sleep, like REM sleep, and having a good recovery curve when I'm physically active, when I'm playing tennis or going for a run. So I want to maximize recovery and REM sleep specifically, because I see that's how I'm productive and I have the best mental clarity and best energy levels during the day. And so obviously as a CEO and founder, that's what I want.
Patrick, I want to ask this question, which I ask most of the guests on this program. On most days, you are thriving and you're focused on trying to thrive better, whether you're awake or asleep, and the best ways that you could perform it. But we all have days, obviously, when we're not quite kicking on all cylinders or the numbers aren't showing up the way we'd like to. Other than obviously getting a better night's sleep or doing your physical activity, what practice do you seek, or maybe which individual do you seek out to help get yourself back on the thriving track?
That's a really good question. My go-to now is to send a message to my coach on Span and to get a quick tip pretty quickly, or to look at some of the materials they've shared before. We've got content on the app with different tips, and one of the areas that I've discovered in last year is breathing exercises. I've been practicing it without really knowing what different types of breathing you can do and all that for 3 years. But specifically this year, I've learned about box breathing and other methods like this. And it's an incredible tool that you can use in a lot of situations, and it's allow you to reset your mind, and you'll forget about the stressors of daily life and all that, and sort of hit reset basically very easily. And another one is non-sleep deep rest. And then often practicing both in the same day or maybe at the same time are really useful.
So let's do the admin part of the show before we walk down Fun Street. Patrick, share with the listeners places they can learn about Span, where they could sign up, informative stuff, websites, URLs, social handles, whatever it is. We'll put it in the show notes, but it always gets more engagement when they hear it from you.
Yeah, so you can head to the website. It's www.span.health. And you can request access on the website today. We're pretty quick in terms of sending invites, so you'll get access pretty quickly. And then we're always up to chat. We love to hear from people who are interested in this or thinking about buying a wearable or just curious about all of this. And so you can reach out to us on Twitter. I'm at Patrick Samy. And then you've got my co-founder, Dr. Adam Bat, DRADAMBAT.
Spectacular, by the way. Really good website with lots of good tweets and Twitters that you can actually all access, and all the different links that you could sign up for. And obviously, when you request access, they can learn about what this program is and how they could sign up and what those plans are. He also has got a really cool Infinity Span logo, which you got to check out, folks. It's very, very neat. Nicely done. Whoever designed that, give them kudos. It's nice. It sticks. It pops. You ready to go down Fun Street with me here, Patrick?
100%, yeah.
Okay. Share with the listeners what you shared with me was your all-time favorite movie.
Interstellar.
Okay. Why does that movie connect so much with you?
When I read your question, I was really wondering, like, what's the movie that's really stayed in my mind and for a very long time, and where the feelings you get, that both the emotional side, but also the more rational side of, like, allowing you to take a step back and think about, the universe and all these things, and understanding what could be possible that we ignore, I think is what that movie really triggered in me. And obviously it's science fiction and all of that, but I think it was just really well made from that perspective. And I think Nolan is a master in this kind of
he really is. I kind of forget that he's the one who does it. He does such a good job of, when I think of directors, Nolan it breaks time up, has a thing with time in all of his movies. It's a little bit, non sequitur, very much almost like Quentin Tarantino a little bit, but time is always a big component of all of his movies, and an injected weird variable for you to think about. So that's
very true. Yeah.
Very poignant. Okay. The way we work here in the speed round, Patrick, which I know you're prepared for because you're well rested. You've got devices on you that are measuring everything. Hopefully your heart rate isn't getting too excited for this too much, that it stays within the zone. But what we want to do here is I want to share with the listeners things that make you thrive, things that lift you up, that motivate you, that basically are some of your favorite things that you like to address in each one of them. And they're pretty easy. And there's no wrong answers as I ask you the questions because they're your answers. So here we go. You ready for it?
Yep.
Okay. Of late, a song that you love to listen to, or maybe one that pumps you up.
Most of the songs on the latest album of Parcels.
Oh, okay. Very cool. Favorite food that is not a dessert?
I'm French, and I love this thing, which is cured meat. It's cured duck, basically. It's really good.
A favorite dessert?
Probably like a very simple chocolate mousse.
Obviously, we had to get two French things going on in here. We weren't going to deter from mousse. An activity you wish you did more of?
Probably strength and mobility training.
Oh, wow. An activity you wish you did less of?
Meetings, or like sitting, or I do a lot of standing meetings, like just at a stand-up desk. But I wish I had a better balance, or I could find a way to do some meetings walking, and have a better balance of getting a walk in, a long walk, or like a 30-minute walk in every day.
Sitting is the new smoking, which I totally agree with you on that. If I were to snap my fingers, Patrick, Samy, and you could be anywhere in the world, where are you?
Japan.
Oh, Japan. Okay. You've been, obviously.
Not yet. And that's
Not yet?
Why it's been on the top of my list. And pre-COVID, I think it was going to happen. And now, probably soon.
Tokyo's an amazing city. And obviously, the whole countryside is great. So definitely get there. Enjoy it. Patrick, Samy, Span. Amazing stuff. Really conscious about all your health devices and an absolute health coaching method, pairing digital together. Such a smart technology. Kudos to you. Continued success for the business, more growth. And thank you so much for coming on Thrive Loud and sharing why this is going to be something that obviously we're going to be talking a lot more of, but hopefully be talking a lot more about you and the success that Span has as well.
Awesome. Thank you so much for having me.
You got it. And to all our listeners out there, thank you for joining us. And until next time, keep moving onward and upward. And remember, be brief, be bright, be gone.
You've been listening to Thrive Loud with your host, Lou Diamond. Check us out on the web at thriveloud.com and follow us on Instagram, LinkedIn, Twitter, and Facebook at Thrive Loud. And check us out on the Good Pods app at Thrive Loud, where you can follow, listen, and connect directly to Lou and all of the Thrive Loud episodes. Thanks for listening.